How does methotrexate for the prevention of the atherosclerosis events? Definition. Atherosclerosis, a disease of the arteries characterized by the deposition of plaques of a fatty material on the inner walls. Methotrexate, a synthetic component that interferes with cell growth and is used to treat leukemia and other forms of cancer.
What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.
Obesity and physical inactivity. Although the exact causes of atherosclerosis are not clear, many scientists think it begins with damage to the inner wall of an artery called the endothelium. Over time, substances traveling in the blood, such as cholesterol, fats, and cellular waste products, accumulate inside the damaged area of the arterial wall. Chemical reactions occurring within the buildup of material cause cholesterol molecules to oxidize. This initiates an inflammatory response in which the endothelial cells at the damaged site release chemicals that signal a call for help. In response, monocytes from the bloodstream travel to the damaged site.
This kind of disease can be difficult to be treated. That's why nursing have a very important image in this situation by setting all the aims of nursing out of that are promoting health and preventing aggravation in the disease of the patient.
Inflammation reduction trial for me is fascinating because at first sight the implications are here's a negative trial, but actually it tells us something really interesting about the biology. We know that the IL-1 beta IL-6 pathway from the inflammasome is implicated on the basis of the previous CANTOS study. Now here's a different approach without selecting individuals at high CRP. Using amount of methotrexate that was sufficient to influence the hematological markers, but it did nothing. And it did nothing to the IL-1 beta IL-6 pathway. So I think that pathway is crucial in terms of modifying inflammation and plaque behavior.
I was surprised it didn't lower C-reactive protein, and Dr. Richter is the PI. So why did Dr. Richter choose a drug that doesn't lower C-reactive protein to test? But it certainly is a nice trial to show that you can't just use any old anti-inflammatory drug. You have to use ones that meet specific pathways. And certainly with the results of the CANTOS trial, the IL-1 pathway appears to be the one to approach. But it didn't disappoint me or discourage me about the idea that directly targeting inflammation can still be beneficial for cardiovascular patients.
I think that with each of those trials, we've got to specifically look at that pathway. And we've got to look at the questions of, is the extent of dose sufficient to modulate that pathway in the plaque? because if not, we may be facing another negative trial. There have been some interesting trials with colchicine already that look encouraging, but they were small.
And so I would like to have some sort of direct anti-inflammatory agent that has been demonstrated to help cardiovascular patients available to my patients. And then I'm also excited about the Ldmftpoae trial because colchicine is inexpensive. It's been shown to be very safe. It's already used for not only treating gout, but for treating other cardiovascular things such as atrial fibrillation and pericarditis. And so it might just fit right in if it becomes evidence.
Pros. Atherosclerosis can be prevented by a regular exercising, having a healthy life and a balanced diet and a positive attitude. And an alternative approach to inflammation inhibition with low-dose methotrexate might provide similar benefits treated with another antibody. Cons. Atherosclerosis can be caused by bad habits like smoking, substandard diets, lack of physical activity, and unhealthy anger and stress levels. It is a serious medical condition and it itself that can be mainly precursor to other serious health problems caused by blood clotting. Among patients with stable atherosclerosis, low-dose methotrexate did not result in fewer cardiovascular events than placebo.
Her doctor told her that she is at risk for developing atherosclerosis. Jill is nervous and wants to find out more about what this means. So what exactly is atherosclerosis? Atherosclerosis is a common condition in which a fatty substance known as plaque begins to build up within arteries in the body. Arteries are blood vessels that carry oxygen and nutrients to different organs. Over time, as plaque accumulates and hardens, arteries narrow, which results in restricted or blocked blood flow. This prevents oxygen from reaching different tissues in the body and can lead to serious complications such as heart attack, stroke, or death. According to the Heart and Stroke Foundation, atherosclerosis is the leading cause of death in Canada, with 1 in 5 deaths caused by the disease.
Issues apply in Ecuador. 7% of the healthy population suffers atherosclerosis or hacking of the arteries, the leading cause of death in the world due to the accumulation of fat, cholesterol, and other substances that from plaques the higher of impossible blood flow. About 1 in 7 deaths in the US is caused by coronary heart disease.
People will ultimately die from cardiovascular diseases, which includes heart disease and stroke. Hello, I'm Erin Mikos. I'm an associate professor at Johns Hopkins, epidemiologist. What this means is that I study populations of individuals to determine new risk factors that may contribute to cardiovascular diseases. I study a variety of topics, including nutrition, fitness, and blood markers of cholesterol, fats, inflammation, and vitamin D. For example, I recently found that calcium supplements, commonly taken by many adults, may contribute to plaque buildup in the heart's arteries. I'm also interested in understanding mechanisms of heart disease, specifically in women, which may be different than those in men. Identifying those at risk is the first step towards developing strategies for preventing cardiovascular disease, which is the #1 killer of men and women in the United States and in developed countries worldwide. But the good news is that cardiovascular disease is largely preventable, and death rates are declining due to advances in prevention.
Conclusion. Among patients with atherosclerosis low dose methotrexate did not reduce the level of interleukin or interleukin 1 and interleukin 6 or C reactive protein and did not result in fewer cardiovascular events than placebo.
So the cardiovascular inflammation reduction trial, for me, is fascinating because at first sight, the implications are, here's a negative trial, but actually it tells us something really interesting about the biology. We know that the IL-1 beta, IL-6 pathway from the inflammasome is implicated on the basis of the previous CANTOS study. Now here's a different approach without selecting individuals at high CRP, using amount of methotrexate that was sufficient to influence the hematological markers, but it did nothing. And it did nothing to the IL-1 beta, IL-6 pathway. So I think that this tells us that that pathway is crucial in terms of modifying inflammation and plaque behavior.